liver problems can show up in your feet. Here's what to look for. Hey everyone. Today, we're going to talk about something most people completely overlook: how your feet can reveal early signs of liver problems. Now, very important disclaimer right away. This video is not for diagnosing liver disease. Only proper medical tests and a doctor can do that. But the signs we'll discuss today can give you useful clues that something may be off with your liver and overall metabolism. Let's dive in. Why the feet matter. Your feet are the furthest point from your heart. Blood has to travel all the way down and then back up through your circulatory system. So when circulation, detoxification, or fluid balance is impaired, the feet are often the first place where problems appear. This is why conditions like diabetes, vascular disease, and liver congestion often show signs in the lower legs and feet. 1. Red or brown. Dots on the lower legs. One of the earliest signs can be small red or brown dots, sometimes shiny or patchy, usually on the lower legs. This often points to poor circulation. While it can have multiple causes, this pattern is very common in people with liver stress or liver congestion. The liver plays a major role in blood filtering and vascular health, and when it's overloaded, circulation suffers, especially in the extremities. 2. Spider veins and varicose veins. Another important sign is spider veins, also called spider nevi. These are often associated with estrogen buildup, which happens when the liver cannot properly break down hormones. When estrogen stays elevated, blood vessels weaken, veins become more visible, circulation becomes inefficient. This is frequently seen in chronic liver conditions, including fatty liver and cirrhosis. 3. Cracked heels. Cracked heels are not just a skin issue. They can indicate vitamin B3 deficiency, omega-3 fatty acid deficiency, poor absorption of fat-soluble vitamins like A and E. Why does this matter? Because the liver produces bile, which is essential for absorbing fats and fat-soluble vitamins. If bile flow is impaired, the skin, especially on the feet, begins to suffer. 4. Itching on the bottom of the feet. Persistent itching on the soles of the feet can signal fluid and bile backup into the liver. When bile doesn't flow properly, histamines increase, toxins accumulate, itching appears, often without a rash. This is a classic sign of liver congestion. 5. Pain or inflammation in the sole of the foot. Many people are told they have plantar fasciitis, but in some cases, the pain is not purely mechanical, it's metabolic. A congested liver can contribute to inflammation, fluid retention, poor tissue repair, which can cause pain and stiffness in the bottom of the foot. 6. Hot feet. Hot feet, especially at night, can be another overlooked sign. This often relates to inflammation, poor detoxification, impaired circulation. Again, all processes heavily dependent on a healthy liver. 7. Smelly feet. Excessive foot odor may point to detoxification overload. When the liver can't process toxins efficiently, the body pushes them out through the skin. This often happens alongside gut imbalance, kidney stress, intestinal congestion. These systems work together. If one is overloaded, the others suffer too. 8. Pitting edema, fluid retention. If you press your finger into your lower leg and it leaves a dent that stays, this is called pitting edema. This indicates fluid backup, which is very common in liver dysfunction. The liver regulates
9.
fluid balance.
Toenail fungus and
when
nail
it's
changes.
impaired,
People with
swelling
liver issues
appears
often
in the legs
experience
and feet.
toenail fungus, thicker yellow nails, loss of the white crescent, lunula, at the nail base. This reflects weakened immunity, gut microbiome, imbalance, poor circulation, all closely linked to liver health. What causes liver problems? Some of the biggest contributors include excess sugar, especially high fructose corn syrup, alcohol medications, ultra-processed and canned foods, lack of vegetables and antioxidants, excessive protein intake over time. Without enough enzymes, fiber, and antioxidants, the liver becomes overwhelmed.
Supporting liver health naturally. One of the most effective approaches for supporting liver health is this: reduce sugar and refined carbohydrates, increase vegetable intake, support healthy bile flow. Allow the liver enough time to recover through metabolic rest. Many people find that intermittent fasting, combined with a low-sugar, whole food diet, can dramatically improve liver health markers over time. Final thoughts. Your feet can tell you a lot about your internal health. They do not diagnose disease, but they can warn you early. This gives you time to take action before serious problems develop. If you notice several of these signs together, it is worth paying attention and speaking with a qualified healthcare professional. Disclaimer: this video is for educational purposes only. It is not medical advice, diagnosis, or treatment. Always consult a qualified healthcare provider before making changes to your diet or lifestyle.